Good evening, everyone. I am so grateful to be here with the Labor Campaign for Single-Payer Healthcare, Healthcare Now, and so many healthcare champions who are organizing to finally guarantee healthcare to everyone as a human right. As we officially begin the Biden administration, I know that many of you are wondering about the future of Medicare for All. And as the proud author of the Medicare for All Act in the House, I'm honored to be joining you for this strategy session. I want to first recognize the tremendous victory we achieved in defeating Donald Trump. And I want to especially thank young people, progressives, Black, Brown, and Indigenous voters who have been building infrastructure in key states like Georgia and Arizona and turned out in record numbers this year because they understood what was at stake. This victory took every one of us, transforming Joe Biden's platform into the most progressive of any presidential nominee in recent memory, and working to turn out people for a better tomorrow. And we did, at the same time, re-elect every single incumbent who co-sponsored Medicare for All, including 8 who were running in swing districts. So let's be clear. We took back the White House. We flipped the Senate, we kept the House, and we got a mandate, clear direction to ensure that this new administration does not defend the status quo, but delivers the very real and urgent change that people need in their lives. That's why we can't let up on our fight for Medicare for All. We have made tremendous gains in broadening and deepening our coalition, but we still have a lot of work left to do when it comes to building our national grassroots movement. While we celebrate that we had historic congressional hearings on Medicare for All in the last session, we must ensure that Medicare for All continues to be a critical part of the legislative conversation in this new session. That includes additional hearings, such as the commitment I received in the Small Business Committee. And with our new members of Congress, including 8 new progressives that we all helped elect, we need to work to make sure that we have even more co-sponsors on my Medicare for All bill when it's introduced next month. I don't want to sugarcoat the fight that we have in front of us. This moment in history seems tailor-made in so many ways to ensure finally that every person in America is guaranteed healthcare by the government. Those who have supported a single-payer system have only redoubled their belief in that system during the pandemic. Even Fox News had an exit poll during the November election that showed that 72% of people supported government-run healthcare. But the challenges are also clear. Because of a well-funded, extensive misinformation campaign from the for-profit healthcare industry, the truth is that large majorities of the American people have become even more solidified in recent polling about maintaining private health insurance, even as they support a transition to guaranteed public health care. And so even the simple incremental step of establishing a public option that is administered by Medicare and not private insurance companies is now being attacked by those same for-profit companies that benefit from the status quo. Now more than ever, Democrats must not let the industry or Republican talking points dictate our strategy. But we also must be clear about the challenges that face us. We need to continue to build our movement, particularly in places where elected officials in Congress are not already supportive of Medicare for All. That means empowering our base with the best arguments and investing in organizing in local infrastructure. We have to build the public case for Medicare for All through hearings in the House and through a series of steps that establish the foundational pieces of Medicare for All. With this new administration and a Democratic Senate alongside our Democratic House, we'll have even more opportunities to push forward the legislative groundwork for Medicare for All while continuing to build the demand at the grassroots. Last year, Senator Sanders asked me to serve as the co-chair of the Biden-Sanders Unity Task Force on Health Policy. My goal became to incorporate as many of the foundational elements of Medicare for All into the Biden platform in order to put us on a more direct path to ensuring that every person has health care. Through those negotiations with the Biden team, we gained their commitment to many progressive proposals that we will fight to preserve as the floor and not the ceiling. I believe the election results in Georgia only reiterated what the American people told us in November, that we have a mandate to deliver real change in this new Congress that includes the foundational elements of Medicare for All, that includes beginning the process of untethering healthcare from jobs by automatically covering anyone who becomes unemployed through Medicare. It means providing more people with reliable public health insurance by lowering Medicare's eligibility age to 50 and covering those under 25. It means a bold prescription drug pricing plan that ensures that no American is paying more for their prescription drugs than anyone in any other country. It also means finally providing health care for immigrants, including eliminating the restrictions on safety net services for immigrants that were put into law decades ago. And it means investing in addressing our long-term care crisis. Our task force made many of these policies part and parcel of the Biden campaign promise. And already President Biden has put into his COVID relief package bold changes that include some of these commitments, such as hiring 100,000 public health workers and ensuring that COVID treatment and the vaccine are free to every single person across America. And President Biden's Build Back Better agenda includes what we negotiated last summer, the creation of 600,000 new long-term care jobs so that we can eliminate the 800,000 person waiting list and give people a choice of having their loved ones receive care at home. That is thanks to your work, as my Medicare for All bill was the first ever to include long-term care. These are just the beginning. You all know me and my background as an organizer for working people, and you know that ensuring a single payer health system is my top priority. I'm going to continue pushing President Biden and his administration, including Secretary Becerra, who we know supports Medicare for All. And I'm going to continue relying on all of you to be organizing alongside me every step of the way, because we all know that Medicare for All isn't just what we believe in, it's what America needs. Our accomplishments in the last 2 years in Congress with the first ever hearings on Medicare for All, on the task force, at the ballot box, and on the ground prove that we can do this. We can achieve real progressive steps that begin to transform our healthcare system into what we know we need. It will take all of us standing up, speaking out, organizing, and fighting to demand healthcare as a human right. And when it happens, when we make Medicare for All a reality, it will be because of you, because of all of us. So thank you for the work you've already done. Thank you for the work you'll continue to do, and thank you for making this progressive movement possible. I am so proud to be in this fight alongside you.